So come on in. I'm going to perform hand hygiene. See right here. Hello, my name is Sean, nurse practitioner. Thanks for coming in today. We're going to do a head-to-toe assessment, okay?
Okay.
So as my patient walked in the room, I was assessing that she did have a smooth gait. It was not antalgic. She had good eye contact, good grooming, well-dressed. Does not appear to be malodorous or have any issues with posture or body habitus. Do you know what the date and time is today?
I think it's January 27th around 11 o'clock.
Good. And do you know the nature of this visit?
I'm assuming like a physical health exam.
Yes, ma'am. Good deal. Okay, patient is alert and oriented, person, place, and time. So, we're going to just go ahead and move through this head-to-toe assessment. It's going to involve me touching and testing parts of your body, and I'll explain more once we get going. Okay. Do you have any questions before we begin?
No.
Okay, so we're going to go ahead and have you sit on the stool here for the sake of recording. Good. And look at me. Okay, so we're going to go ahead and start with the head. So I'm going to palpate the scalp, bilateral, for any lumps, tenderness, maybe looking for any skin breakdown in the back of the head, looking for any infestations, none noted, very good. Palpating the base of the occipital, very good. Good. Anyone look at me? I'm going to go ahead and assess the TMJ. So go ahead and open and close. Good. One more time. Good. No clicks noted, no tenderness. I saw a little wince there.
Yeah, something felt weird. But...
Okay. Say one more time. Okay. Good. No clicks. And assessing the masseters. Go ahead and clench your jaw for me. Good. Nice and toned, bilateral. Very good. So now we're going to go ahead and move on to the eyes. So looking at the sclera, which is nice and white. Looking at the cornea, this is clear. The conjunctiva is pink. No excessive tears noted. No discharge noted. Go ahead and close your eyes for me. Looking at the eyelids, they're nice and symmetrical. There's no eyelid lag. Go and open for me. Very good. Very nice. Okay. So now we're going to go ahead and assess the extraocular movement. Look at my tip of my finger. Good. This is the H pattern test. Looking for any nystagmus or sudden juts in movement. And none noted. Very good. Just going to grab my instruments here, my pen light. So now we're going to assess the pupils are equal, round, and reactive to light. So look at my nose for me, and just going to shine a little bit of light. Good. Pupils are reactive to light. Good. Also assessing for the concentric pupil reflex. Good. And that opposite eye is accommodating the light. Very good. Intact. So now go ahead and look at the tip of my finger, nice and close. Very good. And then look at the wall behind me. Good. And back to the tip of my finger. Nice. So I notice the pupils converge on my finger and accommodate the wall far behind my head. Okay. At this point, we would assess the visual acuity with the Snellen eye chart. Okay. So now moving on to the nose. From first appearance, looking at the external nose, looking for shape, symmetry, maybe any lesions, nothing noted. I'm going to look at the internal nares, any redness, swelling, or discharge, none noted. So now I'm going to actually assess your nasal patency and sense of smell, okay?
Okay.
So go ahead and close one nostril like so, and take an inhale through your nose. Good. And the other side. Good. So good nasal patency. Do you have a cold at all?
No.
Congested? No. Okay.
Okay.
Good. So now we're going to assess sense of smell. Go ahead and close your eyes and close one nostril.
Like this?
Uh-huh.
Yeah.
And tell me what you smell.
Peppermint.
Yes. Good. And close the other nostril, your eyes closed. And tell me what you smell.
I think garlic.
Yes. Very good. Sense of smell, nasal patency intact. Okay. We're going to move on down to the mouth. So, first glance, looking at the lips for symmetry, color, moisture. Do you use chapstick?
Yeah, occasionally.
All right. Go ahead and open your mouth for me. Good. Looking at the subbuccal mucosa, the gums and palate. Looking, go ahead and stick your tongue out. All surfaces of the tongue. Looking for moisture, redness, lesions. Go ahead and open your mouth for me again. Put your tongue down if you can. Looking at the posterior pharynx for any swelling or redness, and also looking at the tonsils for any swelling or redness, none noted. Good. Go ahead and say ah with your tongue out.
Ah.
Good. All of it rises and falls midline. Very nice. Okay. So now we're going to go ahead and assess the neck. Looking for the trachea, which is midline. Looking for any lesions on the skin. Very good. Going to assess the lymph nodes. Pre-auricle, any tenderness or swelling. Post-auricle, the occipital, anterior cervical, posterior cervical, and posterior cervical in the other region, as well as supraclavicular. Excuse me. Very good. That noted. We're going to work our way around the back. Take a pit stop at the ears. Oh, you okay?
Yeah.
Okay. Mm-hmm. So looking at both ears from the outer aspect, looking for symmetry, piercings, any lesions, skin breakdown. Very good. And then, so noted. Take a look at the external auditory canal. For any redness or discharge, maybe impacted cerumen. Good. Take a look from this side as well. Very good. None noted. Nice healthy ears. Okay. So we're going to assess your hearing. I'm going to go behind you and say a couple words. I'm going to whisper them. I just ask that you repeat them back to me. Okay? Mm-hmm. So go ahead and close your ear, like so. Good.
Watermelon. Baseball.
And the other ear.
Camera. Tortoise.
Very good. Okay. And as far as palpation goes, palpating the pinna for any tenderness, lumps, pressure. Also palpating the tragus for any pressure there. None noted bilateral. Very good. Okay. So now we're going to go ahead and move around to the posterior aspect of the neck. For this part, we're going to have you flex forward just a little bit. Good. Get my fingers. Find the cricoid cartilage. Go just below, looking for the thyroid. I'm going to press on one side, the right side. Feel on the left as you swallow. Go ahead and swallow. Good. Feeling for any enlargement, masses, or tenderness. And then I'm going to repeat that in the opposite pattern. Okay, go ahead and swallow. Good. No masses, enlargements, or goiters noted. Okay. And assess the carotid pulse. Good. 2+. And that is 2+ bilateral. Very good. Going to take a listen for any bruits using the bell aspect of my stethoscope. Okay. No Bruits noted. Very nice. Okay. So moving on, we're gonna go to, might shift gears here and do upper extremities.
Mm-hmm.
So if you can, go ahead and have a seat on this for me. Right here. I'll pull you a little closer. Okay. Sure. Perfect. Thank you. So assessing upper extremities, looking at the skin of the hands, the fingernails, the forearms, upper arms, back of the elbow. Looking for any skin breakdown, lesions, redness, anything of concern. Looking good, none noted. I'm going to go ahead and start with the fingernails. Looking at the shape, they're nice and round. Color, they're pink. Also smooth. Assess capillary refill. Good. Within 3 seconds, some nice healthy perfusion there. Looking very good. Okay. So now we're going to go ahead and just move your assess pulses here. Two plus bilateral. Also assess. Go ahead and relax your arms. Good. Assessing the brachial pulse. Pass my finger. 2 plus bilateral. Very good. Okay. Now we're going to go ahead and move on to the range of motion. So if you can just go ahead and mimic me. Okay. Flexion, extension, ulnar radiation. Ulnar deviation. Radial deviation, ulnar deviation.
So in and out.
Yes, sorry for the mix-up.
That's okay.
Flexion, extension. Good. Nice range of motion within normal limits of upper extremities. Go ahead and go like so and assess the strength. Okay, go ahead and pull in towards your body. Good, and push out towards your body. Good. Strength is 5 out of 5 bilateral. Very good. Assess sensory neural reflexes here. If you can just go ahead and relax your hand for me. Okay. Just assessing reflex of the brachioradialis. Move on to the biceps. See if I can get a good one here. Again, a little blip there. Then also the triceps. If you can just relax your arm. Good. Very nice. And on the other side, brachioradialis reflex. Good. Bicep reflex. Good. And tricep reflex. Relax. Good. Good. Very nice. Sensory reflex is intact. Okay. Very nice. So we did range of motion, strength, cap refill, sensory neural reflex. Okay. So we're going to go ahead and test sensation. So for this next part, we're going to assess your ability to feel a soft touch and also differentiate between a sharp and dull touch. Okay? So go ahead and close your eyes for me. I'm going to take a little piece of cotton and you just let me know when you feel it on your forearm.
Feel it. Feel it. Feel it.
Good. Sensation to soft, intact. Then also I have a paper clip here with a sharp end and a dull end. You just let me know which end you feel. Okay? Close your eyes.
Sharp. Sharp. Dull. Sharp. Sharp.
Okay, very good. Discrimination between sharp and dull, sensation intact. Okay, so now we're going to go ahead and have you spin around with your shirt off, if you don't mind, and look at the posterior aspect of the chest. I'm going to Assess for any skin breakdown or lesions, maybe any previous back surgeries of note. See a little scar here. Good. Blood blister there. So I'm going to take a listen to the lungs with the diaphragm, all 10 regions. Okay, so go ahead and inhale for me. Nice. Very nice. Clears. Lungs are clear to auscultation. If you can, rotate 90 degrees this way, and we'll listen to the right side. With the diaphragm as well. Go ahead. Very nice. Clear to auscultation. And then 180 degrees to the left for me. Good. Assessing the left side. Inhale. Okay. Clear to auscultation. And then go full circle, face me. Good. Moving on to the anterior chest. Just first glance, inspecting the skin for any breakdowns, any previous surgeries, anything I should know about. Okay. Gonna take a listen to the lungs with my diaphragm. I'm just gonna move you in a little. Perfect. Okay. Good. Bigger inhale. Good. Okay. Midline. Very good. Lungs are clear to auscultation. Now we're going to listen to the heart. We're going to do this with both the bell and diaphragm. Starting with the bell over the aortic region, pulmonic region, Erb's point, tricuspid, good, as well as the mitral. Okay, I'm going to switch to the diaphragm. Again, aortic, pulmonic, Erb's point, tricuspid, good, and mitral. Okay, very good. S1, S2 present, no murmurs, clicks, or rubs noted. Okay. Just going to go ahead and assess precordium for lifts or heaves. Good. And none noted. Very nice. Okay. So now we can go ahead and move on to the abdomen. So we're going to have you lay on your belly. I apologize, lay on your back. Okay, make sure can't let me see here. So initially just looking at the 4 quadrants of the abdomen, we have the upper right, upper left, lower right, and lower left. looking for any lesions, previous scars. We're going to start by taking a listen to the valve movements, make sure they are active and present with the diaphragm, upper right quadrant, active and normal, upper left quadrant, active and normal, lower right quadrant, very active, normal, and lower left quadrant, active and normal. Take a listen to the arteries with the bell. Start with the abdominal artery, the right renal artery, the left renal artery, the right iliac artery, and the left iliac artery. I would also auscultate the femoral arteries as well. So we're just going to go ahead and assess for tympani. That nice sound of almost like a hollow sound. I don't know if the camera will pick it up. Okay. Promise my hands are warm. We're going to do some light palpation. Upper right quadrant. Upper left quadrant. Pretty pronounced rib cage here. Lower right quadrant. And lower left quadrant. As I'm doing this, I'm also assessing for the shape of the abdomen, relatively flat, not very protuberant. Also going to do the deep palpation. So you're going to feel a little pressure here, okay? Start with the upper right quadrant. Using both hands to feel a little deeper. At any point, I trust you'll let me know if you feel any discomfort. Lower right quadrant. And lower left quadrant. While I'm palpating here, I'd also assess for the inguinal lymph nodes as well, for any tenderness or mass. None noted, all within normal limits. Okay, so we can now go ahead and have you sit up. We're going to move into the lower extremities. I'm going to have you back a little bit, like so. Okay. So starting with the visual inspection, looking at the skin of the lower extremities, the ankles, the feet, the pretibial area, the calves, upper thighs, looking for any skin breakdown, varicosities, patches of hair, maybe a start of ulcers at all at the lower shins. All looks good, nothing of concern noted. Going to palpate the ankles, pretibial and posttibial areas, making sure there is no edema or swelling down here that shouldn't be down here. Good. Also going to assess the posterior tibialis pulse, bilateral. 2+ bilateral. And assess the dorsal dorsal pedialis pulse. This one's a little tricky. See if we can find it here. 2+ bilateral. Also the popliteal pulse. Good for me. And 2+ bilateral. Going to assess strength. So if you can push against my hands, good. And pull against my hands. Good. Strength is 5 out of 5, bilateral. I'm going to go ahead and look at range of motion now. So bring your toes up to the ceiling for me. Good. Nice dorsiflexion, and then push down on the gas pedal. Good. Good plantar flexion. Now, if you're to roll your ankle inward, invert it like so. Good. Assessing inversion, and then the opposite way to eversion. Good. Range of motion of the ankle within normal limits. Good. Okay, so now we're going to go ahead and assess the hip range of motion. So if you can, go ahead and stand up for me. Hold on to the counter for balance. And I'm going to mimic, or yours will mimic my movement. Okay? So, one hand on the counter for support. I'm going to look at flexion, extension, adduction across the body, abduction away from the body. Good. Good. Internal rotation and external rotation. Switching legs, flexion, extension, adduction across the body, abduction away from the body. Nice. Internal rotation and external rotation. Okay, very good. Range of motion in the hip within normal limits. Okay? So you can just have a seat here. So for the next part of this assessment, just do some hand hygiene. We're going to go ahead and move into the genital, breast, and rectal exam. For these exams, due to the sensitive nature, we're going to have a chaperone present, certainly hand hygiene, and wear gloves. So for a breast exam, we're going to assess the patient in a seated, leaning forward, and supine position, looking at the skin for any irregularities, any retractions or puckering. To palpate, we're going to have the patient lie supine with their arm above their head. I'm going to use the pads of my finger to palpate in a linear or circular motion, starting at the tail of the spence and then working my way down throughout all of the breast tissue. Of course, do this bilateral as well, feeling for any lumps. Also a good time to educate patients on doing their monthly self-exams. Okay. Also assessing the axillary and supraclavicular lymph nodes as well for any swelling or tenderness. Okay. Moving on to the female genital exam, we'll be assessing the skin, looking at the vulva and labia for any piercings, lesions, or hair distribution. We would then go ahead and separate the labia to inspect the urethra and vaginal canal, make sure there's no redness or discharge in there. Also gently palpate the Bartholin's glands on each side for any tenderness or swelling. Switching gears into the male genital exam, we would assess the skin of the genitalia, looking for any lesions, piercings. Also assess the urethra for any discharge. We would palpate the testes for any lumps or masses. And we would also do a cremasteric reflex exam. So essentially we'd take this and stroke the inner thigh of the male and look for the same side testes to ascend, and then do it on the other side. Stroke the inner thigh, looking for that same side testes to ascend. Okay. For the rectal exam, we'd have the patient lean forward over an exam table with their feet internally rotated, with a gloved, lubricated, or with a glove, one finger lubricated. We would gently palpate the prostate, looking for or feeling for any irregularities or sensitivity.